Pulmonary embolism is a common clinical problem encountered in day-to-day practice of medicine. Despite the improvement in thrombolysis and anticoagulation protocols, as well as interventional radiology technology, the care of submassive pulmonary embolism patients remain a challenge. Hi everyone, I am Pramod Guru, a critical care medicine consultant and associate professor of medicine at Mayo Clinic, Florida. I'm also the medical director of ECMO service. I'm excited to be here with Dr. Giri to give an overview of our upcoming brief report titled Ultra Low Dose Systemic tPA in High Risk Pulmonary Submassive Pulmonary Embolism. The review is due in the June issue of Mayo Clinic Proceedings. We are sharing our approach to these high risk groups in this review. I request Dr. Giri to provide an overview of our protocols and experience.
Thank you, Dr. Guru. I am Dr. Abhishek Giri, a research scholar in the Department of Critical Care Medicine in the Mayo Clinic, Florida campus. In our review, we described our experience in 4 patients with the use of ultra-low-dose systemic tPA. We administered tPA at the rate of 1 milligram per hour for 24 hours to all our patients. All the patients showed clinical improvement without any adverse complication, such as bleeding or hemodynamic compromise. By this approach, we successfully avoided catheter-directed therapy. Since the initial success, our teams so far able to manage more than a dozen of patients with similar protocols as described in our review. From the clinical standpoint, our observation provides as alternative strategy to manage high-risk submassive pulmonary embolism patients. The patients are benefited by avoidance risk associated with interventional radiological procedures and experience the similar benefits of thrombolysis.
So as Dr. Giri nicely overviewed, the indication for thrombolysis in submassive pulmonary embolism patients is not universally recommended. Our protocol shows the benefit of low dose thrombolysis in the high risk submassive pulmonary embolism group. With this protocol, the patients are benefited because they do not have the increased risk of bleeding, and the physicians are also able to manage these people without getting any interventional radiology procedure. We believe that the protocol is an alternative, less invasive approach for the care of high-risk submassive pulmonary embolism patient. We are planning to explore our protocol's effectiveness in a more systematic manner in future with large number of patients in our campus. I would like to thank the entire Mayo Clinic Proceedings team for their help, and thank you very much for your time.
We welcome you all to read our article and provide your thoughts and suggestions. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.